with their amazing toolkit.
Awesome. Thank you so much. And hello, everyone. Thank you for having us. The warm up to this meeting is one of the favorite things of my entire month and year so far. Thank you. Grateful to get to be here. My name is Diana, and I serve as section manager for the prenatal through age 25 behavioral health team in DBHR. And we partner with the peer team a lot on our work and always looking for ways to do that more. I came to this work and my heart for this project stems from having my own experiences as a young adult of needing help and not finding anything that looks like help. And then I moved into direct service for a long time and watched people ask for help and get something that the system said was help that wasn't what they asked for and didn't help. And thought, I wonder if there's levers in the system somewhere to bend the system towards people. And another decade or so later, we had an opportunity to work on Washington Thriving, which is what Hannah and I get to be here to share with you today. I look forward to questions that you have as we go. And with that, I will turn it over to Hannah to introduce herself and kick us off.
Thank you, Diana. Good morning, everyone. My name is Hannah Trapphagen. I work with Diana over at the Healthcare Authority and have the pleasure of reporting directly to her, not only as my supervisor, but she has been integral throughout the process of developing the Washington Thriving Strategic Plan, which we'll talk about here in just a minute. A little bit more about myself and my background. I've found a common theme among many of my colleagues throughout my career that I was drawn to behavioral health, not really understanding why I ended up in this space. And throughout my journey of working in a lot of different focus areas, I figured out it's because I also have my own lived and living experience that, you kind of don't realize all of a sudden all at once, or you just end up in the right spaces and learn more about yourself along the way. So um, I've worked in substance use prevention, statewide tobacco prevention in other states, as well as working in the autism, intellectual developmental disability field, and found myself a couple years ago with the opportunity to join in this statewide effort that we'll talk about more today. So thank you all so much for having us here and excited to engage in some good discussion and answer any questions that come up for you all throughout our time together. So we always like to start out by sharing the full value agreement. This was developed by which is made up of folks with lived and living experience, both as young people and parents and caregivers with the behavioral health system, in partnership with folks who deliver direct services, agency partners. And this full value agreement served as a shared understanding of how to show up and participate in spaces where respect, compassion, and care come first. We listen to one another, we share the space, and really spend the time listening and understanding one another, which was really important in understanding what the needs are for our state to improve behavioral health for those using the system. So we've said Washington Thriving a couple of times, so we will define that now for you all. So Washington Thriving is a comprehensive statewide behavioral health strategic plan for prenatal through age 25 and their families and caregivers. This strategic plan was developed by the Washington Thriving Advisory Group, which was established by the Children and Youth Behavioral Health Work Group to address the ongoing crisis for behavioral health of young people, children, and families across the state, really aiming to affect transformational change across the behavioral health system, which behavioral health encompasses a lot of different things. It's not just mental health, but it includes substance use disorder, prevention, promotion, all the way through treatment, recovery support. and to outline a vision for how this array of supports, this continuum, can be accessed through a range of settings and really meet people where they're at with the right level of support that they need. The strategic plan also provides an actionable roadmap with a focus on equitable access across every stage of life to developmentally appropriate, high quality, culturally attuned supports and services. So as we mentioned, the strategic plan was developed with the Washington Thriving Advisory Group, but it also engaged in discussion groups, listening sessions, and other modes of input from folks across the state with lived and living experience, with people delivering direct services in a variety of different environments with different populations. And this plan was about 3 years in the making and was submitted to the legislature just this past November. So there is a huge PDF available on our website, which Diana will walk you through and point you in that direction. But alongside the ginormous document is also a companion website that allows kind of a different way to digest and learn about the strategic plan. With that said, I'm going to stop my first portion of this presentation and pass it over to Diana to walk through a little bit more.
Thank you. I am theoretically going to share my screen here shortly. Did that work?
I see it.
Are you able to see my screen? Okay, perfect. Thank you. Thank you, Hannah. So recognizing there are all kinds of learning types, we had the opportunity to both have the tremendous PDF that Hannah identified and the ability to put that content online. So I'm going to share this, and it's probably beat me to it, but just in case, here's the link where I am. So yep, she did. Good job, Hannah. Thank you. So if you want to play along and drive your own experience as we walk through this, you are welcome to. The landing page is here. There's a couple ways to get to the strategic plan. And I'll just walk you through kind of the process and content that's here so that as you explore and identify questions or things you want to share, we can touch base on those. Okay, so before we dive in, I just want to double down on something Hannah shared, which is I'm really grateful to get to be here, in that the whole intention of Washington Thriving is to really listen and understand what's happening for people who are trying to access services or accessing them, and learn from that and center that in what Washington Thriving designs and builds as it moves forward. So as she mentioned, the advisory group did that work, and moving forward, there are both pockets of brilliance out there that identifying and exploring and bringing more resources to can be very helpful. And there's also things that are not working, and hearing and understanding that directly from folks who've had experience accessing or attempting to access the system is really the center of this work and the center for implementing. The full value agreement that Hannah showed us at the beginning is, in my mind, also the playbook for how to implement what comes next. As we think about, now we have a plan, what's next? The other thing, just to share, I'm probably being Captain Obvious, but in case I'm not, the thing that I'm so grateful for about this strategic plan is that it gave us support to look at the before birth to 5, which has been a underdeveloped part of the system for my entire career, and the transition age, that 18 to 25, 16 to 25, and recognizing in our system, we have a youth system and an adult system, and in between, good luck, except for pockets of brilliance. And I really am looking forward to seeing how that conversation goes, recognizing there's a whole piece of the continuum that needs to be tuned for that stage of life in ways that really matches what both families, caregivers, and young people are asking for and needing to support that transition to thriving adulthood. So with that, here at the Strategic Plan website, there's another link here or here if you want the big PDF document. The way it's structured, so the website's going to show you what's in the PDF. So the way it's structured is identifying what the needs are and why we need to have all of the efforts across Washington agencies and partners working towards the same goal. Also the vision. So the advisory group that developed this work identified and came up with what the vision for a different, so the vision casting for strategic plan, what that needs to include, what we need to pay attention to make it different out in the world. So you can see what those are. I won't read the website to you because I hate it when people do that to me. And if you want me to, tell me. I'm happy to. I just err on the side of not. So identifying what the system does, what it should do, identifying the core guiding principles that a strategic plan that's going to meet the vision identified and what it has to be. So these we will pause and go through a little bit because I'm curious when we get to question and answers if what your take is as you see it, informed by the people experiencing the system, ensuring that all doors lead to support, offering services to meet the individual needs of the people seeking services, that it is equitable, anti-racist, culturally and linguistically responsive, that it changes based on new information, that it's nimble, listening, watching, seeing, understanding systemically how things are or aren't working, and moves to meet the needs that are showing up and the gaps that are identified and the places where there's something different happening that we need to pay attention to systemically to make sure we're moving the system towards what people need. Invest in prevention and well-being. So that is not saying pulling resources away from places that are critical junctures for families in need. It's saying continue working on that and look earlier and support well-being and ongoing recovery really intentionally as well. And paying attention to not building something for individuals, but building something for individuals who are part of a constellation of humans who impact their experience and care about them. So goals for the strategic plan are to focus on what matters, serve Washingtonians equitably, expand upstream, strengthen the foundation, and make help easy to find and get, as well as making help feel and be actual help to the person seeking. And you'll see all of these have a little more about what's in there. So as the strategic plan was developed, it rolled into three main dimensions. So one that was identified was the need to strengthen infrastructure. Currently, multiple state agencies have pieces of the behavioral health system that they deliver. And currently, they do it in line with what that agency agency's goals and intentions and needs are. The goal here is to conceptualize and put in place a sense of shared mission and goals that as behavioral health rolls out of state agencies, it does so with a shared North Star for the population and or part of the continuum that it serves, so that we're all moving in the same direction. Another area that came up in the strength and infrastructure as we studied other states who have done something like this and have improved mitigating connection and like the need for child welfare or juvenile justice or justice carceral system engagement. There was in those states kind of a state central hub for some of the pieces, and looking at Washington and recognizing both our geography and our population statewide isn't likely to meet all of the needs in the ways the strategic plan identifies needing to. And so looking at potentially having a regional structure that partners across regions, but tends to their region's needs, with understanding what's happening in the region and addressing needs. We will see how all of that rolls out. This is all the concept or the idea as it stood up. And then another dimension is expanding offerings. This is, as Hannah was sharing earlier, that full care continuum: prevention, well-being, early intervention, the typical treatment continuum that we talk about, crisis supports and engagements, and ongoing well-being and recovery support. That full care continuum, paying attention to what's there, making sure it's the right time, right place. Also with this one, recognizing that there are different payers or insurance companies or entities that are contracting with providers to provide services, and similar to how the state agencies operate, sometimes those plans or purchasers purchase for the intentions or the goals that they have for their agency. So the idea is trying to come up with a systemic way to see data, to see outcomes, so that we're all, including purchasers, as much as possible moving towards efficiencies and making sure we have shared outcomes in mind that we're purchasing for. So the system is like this, and the payers come up underneath to be able to see what the structure is and where there's true gaps, so that we can all work together to identify what to do from there. And values in action. This is the idea with values in action is that it is infused and throughout the other two dimensions in everything that happens. This system of care values, and if you have a link to a system of care values in the children's world, it's maybe more known. So I want to make sure everybody can see it, but the core principles really are centering on the experience of people experiencing the system and responding individually with the things that answer the questions they're asking and deliver the help and support they're asking for. Trauma-informed approach. So things that we talk about and currently do have a lot of room to grow in figuring out how to implement these things systemically so that everybody has that experience of being centered in the delivery of their care and having a system that pays attention to how things are purchased to ensure that can happen and ensure it's validated through either funding or supports or training. Hannah, before I go to the long-term roadmap, is there anything you would add with the pieces I've covered so far?
I think you did an awesome job. I always enjoy hearing how you present it versus how sometimes I talk about it. I think it's with these three dimensions, the goal, I think what's helpful to talk through is that the goal isn't, and I think Diana, you touched on this, is the goal is not to reinvent the wheel and start from scratch. Um, Throughout this process, we've looked into other states working towards a similar goal of building a behavioral health system that that is person centered, meeting people where they're at, um, values driven, all of those things. And through that process of learning and looking into how other states have done that, what we've also learned is everyone has started from a different place. So some states like New Jersey, they started with a pretty blank slate and were able to establish something from the ground up to get to this point. Whereas in our state, we already have a lot of different areas doing really great work. Um, and to Diana's point earlier, these things are happening across a lot of different agencies at different levels, at the community, regional, state level. Um, so there needs to be involved in the implementation of this a really intentional effort to continue to learn about and understand what's working well to ensure that we're not tearing down the pieces that are valuable to the system, but instead augmenting, supporting, expanding on those things, evaluating at that point, okay, what are we still maybe missing? What's missing the mark? Or what worked for this region and we tried to put in another region and it's just failing miserably because maybe it needs to be adjusted for a different community. So I think it's important to just recognize that it's not it's not a tear it all down approach. It's actually the exact opposite. We want to hear from people, continue to hear from people about what their experiences are, what's working, what's not working, and why, and build from a place of like a strengths-based approach, not only in serving people, but in this transformation of the system to one that is connected, collaborative, and supportive of people, that families and young people don't get frustrated in trying to navigate a complex system, but that we're connecting the pieces and providing navigation support across the things that are working well, and building out the ability of our system to work intuitively and collaboratively to better support folks within the things that we already have that are working and within the things that we might need to adjust or expand or address in the gaps and challenges that we see as we go. Um, that is the only thing I think I would add, Diana.
That's awesome. Thank you, Hannah. From there, we'll look briefly. I don't know about you all, but when I think about all of this that we've talked about and what it would take and what it means, we're definitely on a long-term roadmap. So as it's been perceived with the recognition that the plan is built to be nimble based on what shows up. So here's the Etch-a-Sketch version that might get shook and readjusted many times as it goes through, but that the first 1 to 3 years is really paying attention to that infrastructure, both at the so thinking fiscally, thinking who does what and are we pointed in the same direction, thinking about what kind of systemic data do we have or do we need to be able to see what the baseline is now, and if decisions that are made are bending the curve in the right way or not. Infrastructure for feedback loops on that data and the development of that infrastructure from folks on the direct receiving and delivery front lines of the system to look at what the data says and say, yeah, that matches what we're experiencing, or no, so that it's synced up and tuned with what's real for people. And then continuing to move those things forward and scale from there. So the other place I'll take you on the show and tell. So we'll do this, and then we'll go back to Hannah with maybe Q&A, and then Hannah has to close us out a toolkit for communications. So if you're looking at this and thinking, I have people I need to make sure know about this, or that are weighing in and sharing what they're seeing and experiencing, that sort of thing, we will follow with that as well. But I'll take us to first initiative just for an overview of a little bit with the timeline. So we talked about the governance, looking for outcomes to see if we all understand the system the same way, and if we have measures and information that is systemic. We have tons of information that's by program or by payer or by, but how do we see systemically? And then the funding pieces. And then for the service continuum, there are several areas that have a real consistent, deep need for tuning or support or development. And for first initiatives, this whole strategic plan has been supported in a public-private partnership. There are philanthropic folks that are interested in some of these areas that also have the current need to be addressed in the system. And in a year where there's going to be less money everywhere, not more, the strategic plan and the philanthropic partners looked at, backing up just a step, there's the tension between what we have to do right now because there's critical gaps, and developing a strategic plan that's talking about 3 to 10 years out. And that feels terrible for people who know what needs to happen right now for young people. So this all, over the last 3 years, has been conversations. And the first initiatives were areas that both have that critical right now need in the system and philanthropic support to help work move forward until there's state funding to pull it forward further. So those initiatives are around perinatal well-being. So this is helping families stay together when families have babies and are working on their recovery and being a parent all at the same time, and what that looks like. And these will develop more as we move forward. The nexus for recognizing kids are in schools, and schools are not behavioral health delivery entities. And I don't know what other word to use. I'll just say the tension or the push-pull there about students needing support to be able to be ready to learn. And there's a partnership that needs to happen with how that happens, how students can access care, how schools can support students being ready to learn and not be on point for doing a whole nother industry of work when they're trained and there to help educate young people. So this initiative is going to explore some of that work. And then on the treatment services expansion, this is likely going to be around some of the places where we know young people are stuck in emergency rooms or settings that are not meeting their clinical needs because there's a gap in how to do that in the community and or in the system. What do you think, Hannah? Should we go to Q&A?
Yeah, I think let's
Or
take a second
Q and
and
A?
yeah, just with recognition that for a lot of folks, this is a lot of information all at once. So we definitely don't anticipate that you have had time to digest and marinate um, all of the information that we provided today. And uh, I like to make a joke that, it's light evening reading. If you just want to print out a chill 90 pages of something and flip through um, some interesting literature, it's always there for you to digest. And um, while we welcome questions, discussions, reactions, it doesn't even have to be a fully formed thought. Uh, we like to hear how it lands for folks so we can continue to engage in dialogue and understand um, how this sits for everyone as we look towards the next phase, which is switching from developing a plan, which is definitely one totally different thing than working towards implementing something. So we're kind of in that transition right now, which gives us a really unique opportunity to continue to learn and tune based off of what we hear from people who are impacted by this work. Um, the last thing I'll say before opening it up is that if things come up after this, if you are, I don't know, doing the dishes and you're like, oh my gosh, I have a question. We are open always to questions, comments, thoughts. I'll put my email in the chat, so feel free to reach out to me if something does pop up in the middle of the night or when you're walking your dog or whenever that might be. But just giving the grace and understanding that this is a lot, especially if you're seeing it for the first time. So I'll stop talking now and open it up for questions, thoughts, reactions, feelings.
I have a question, Hannah and Diana, if that's okay. So thank you, first of all, let me start with that for your amazing presentation, just as good the second time around. So gratitude to you both. And this is an amazing project. Toolkits are always really helpful.
Someone's knocking at my door. I'll call you in a minute.
Oh, okay. Oh,
Uh, okay. Hi, Jacob. So I saw where where it dovetails perfectly with peer support and what you're trying to accomplish, folks who have the same experience working inside of behavioral health systems in order to support others who are maybe new to it. So and a lot of that, it feels very much like what we're doing in other areas, which is perfect because it works, right? Like you said, we're not going to recreate the wheel. Thank goodness for that because whew, these projects are big. But uh, is there, is it a requirement? Are you saying, hey, you need to be a person with this lived experience in order to? Or is there wiggle? Is it like maybe different for billing purposes, and so people don't need to be certified? I think that's what we're going to hear a lot of questions around, or maybe later for our pause thinkers, because like you said, it's a lot of information to absorb. Um, but if somebody wanted to utilize this, where would they utilize it? If you were to say this program would utilize this toolkit, what would that look like for the community?
I'll give it a first a first go and let Diana fill any gaps that I might miss. And while I do this, I'm going to put a link in the chat to the community toolkit that was developed to kind of complement the rollout and sharing of the strategic plan. Also, let me expand you guys back so I can see your faces. All right. So there's a couple things here. So one, we're grateful for anyone who's interested in sharing and talking and learning more about the work, because like we've mentioned probably too many times, and you're like, please stop talking about it. This takes everyone. This requires not only the perspectives and the input that we have already received throughout the process, but that was a time limited effort, and we know that we didn't get it perfect. We know that there are voices, there are communities that either didn't get enough representation or we missed. And um, we don't want to stop including folks and perspectives throughout this process. Um, and so, to that point, because there's only a few of us staffed on this effort, it really does encourage us to encourage others to use their networks, use their tools, and engage folks they know to continue to build upon the folks that are engaging and providing input and sharing perspectives so that we can be as comprehensive and representative as possible. Again, with the full recognition that we're never going to get it 100% right, but understanding that we need to be flexible and transparent about that too. So one of the resources that exists is this toolkit. This toolkit was created to provide folks with uh, some talking points, so already developed talking points, language for sending emails or posting on social media about the strategic plan itself. There's images included that folks can use to just make it a little bit easier and remove a lot of the burden of creating something from scratch to share about this plan with other people that you think might benefit or be interested in learning about it. So this exists, it lives on the website. I provided the link in the chat there for you all. And like I mentioned before, we are kind of in this transition phase. So we're also learning on the back end of what this next year is going to look like. But without a doubt, there's going to continue to be opportunities for folks to learn with us. Um, we this effort is kind of happening through the Children and Youth Behavioral Health Work Group, which will have regular meetings throughout this year. The meeting schedule is currently being developed, but those are open to the public and have public comment periods. So even if you might not be a member of that group, we welcome participation and input and feedback in those spaces. So that's another way that you all can continue to engage. There is also a newsletter, which I will drop the chat. I'll drop the link to sign up for the newsletter as well. If you're interested in just staying up to date with things as they develop, um, this will allow you to receive updates on when those meeting dates are set, but also things that might be shifting or learning about maybe there's legislation and all of these other things that might be happening here. I see, Tan, your message about how are you addressing the rural communities. That is a really great question. Before we switch to that, I want to give Diana a chance to answer Amanda's query if I missed anything that she would like to include.
Thank you, Hannah. You did not miss anything. And I'll add to what you shared with the spirit of this strategic plan, I think, is really challenging the hierarchical structure that our system is set up in that it, if we get it right, implementation will follow how the strategic plan came through the process and turns it upside down so that or right side up, so that the folks who are experiencing the system are the ones at the center informing what should happen from the partners who are getting contracts, funding things, etc. And I say that to this group in particular because I think that perhaps you have an extra special understanding of what that means and feels like when it gets it right and when it is out of tune. And to add to what Hannah is sharing, the importance of, and my hope that it will take all of us continually influencing the potential that this has to keep it right side up, splash upside down, depending on where people are, so that we end up with a balanced, informed, all ships rising strategic plan. So to the question about, is this just certified in certain places or no, this is humans who've experienced the world of either wondering where to go for help or wondering if I need help or wondering if something's wrong. Like all of us clear through to, okay, I made it through that gauntlet. What does that mean about me now and how I interface with the world, like that, the recovery, ongoing well-being piece as well. So anybody in the human experience, from my perspective, has valuable insights, and we need you. We need you in those meetings, in those places. And there's a couple more. This might go a little bit into the next one, Hannah, but I'm going to drop it just because it occurred to me in this meeting. You'll be the first ones to hear this connection to it, and I'll get feedback from my team later if I should have done it different. There are existing places and communities right now where the voices of living experience are informing at a regional level what happens and how things move. So one of those is the Family Youth System Partner Roundtables. I'm going to drop that link here. So if you want to check out your regional FISPERT and just understand what they're doing and how it works, that's an existing resource that actually has avenues into the Children Youth Behavioral Health Work Group as well. And then I will post a link after because I didn't get it pulled up yet. There's Youth Navigator programs or Kids Mental Health Washington regional teams who are also pulling stakeholders together to see where their strengths and needs and gaps are, to identify all the resources in that region. And then when a young person, or is a young person and or caregiver or somebody who cares about them has questions and needs to talk to somebody, there's access portals for each region, and they will consult and connect. And if needed, they'll pull multiple people from that, from their regional system together to meet with that young person and family to figure out how to meet them where they are and get them the next step and help. Thank you, Hannah. So I will hand it back to you, Hannah, for more on that or the next question.
I think that was great. So I will move to the question around how are you addressing the rural communities, and start by saying the need to address and account for the unique needs for different types of communities, rural, urban, suburban, all of those things was consistently brought up throughout the development process. So while in the existing plan, you might not see a specific dedicated strategy that's totally different that says, well, we'll do this for this community and this for this community. It is mentioned throughout that there is a necessity that as the leadership and as the implementation gets rolling, these need to be specific considerations to ensure that we're not developing and standing up things that only work for a specific audience, region, whatever that might be, community. On that note, I do think it's helpful to mention kind of the strategy behind why you might not see very specific things mentioned in the strategic plan. So as you can imagine throughout the process, a lot of different things were brought up, a lot of specific program names, a lot of specific maybe diagnoses or issue areas like this, like rural versus urban needs, there was a lot of that. And on the back end, our project team has probably hundreds and hundreds of pages of literature, documentation, inventory of all of these very, very specific and important areas of our system that need to be included in this transformation. And the strategic plan itself was written in a way that all of those topics, areas, issues have a place to live, even if they're not specifically mentioned by name. And the strategy behind that was really to avoid being uh, exclusionary, with the concern that if we approached the strategic plan by naming everything specifically that should be included in this, that as the system matures and develops and grows over time and new programs are developed and our understanding of behavioral health changes or things like that happen, we were worried that those things would then get left out of this important effort to develop something comprehensive. So it's it more shows up as themes or buckets, as we like to say, as it talks about the areas of the system um, conceptually, so that for the things that we know already exist and that we've heard of, they fit into the plan, even if they're not named specifically. And then as we learn more and as the system develops and things pop up over time, those things will also have a bucket to land in that still will fall within the scope of the work that's going to be done. Um, because I think a lot of people go in there and they're like, control find for my program name. And they're like, oh, they didn't mention me. And it's not that we don't think that that's an important thing or that that's not something we heard consistently throughout the process, but it's an attempt to actually be more inclusionary and to create something that doesn't just sit on a shelf and becomes stale and stagnant over time and becomes irrelevant as the system changes, but to instead be flexible, nimble, inclusive as we learn more, as the system changes. Um, because yeah, the last thing we need is another strategic plan that becomes irrelevant in a year and starts collecting dust. So that was probably more than you asked for in your question. I'm sorry. I sometimes get a little bit on my own uh, soapbox about these things.
Thank you very much. That was very explanatory. I needed that.
I'm glad it helped. Thank you for asking the question.
So we have about 6.5 minutes left, give or take. So now would definitely 100% be the time to ask any additional questions that you may have that are lingering. And remember, no question is a wrong question. And most of us, myself included, learn through repetition. So if you are a pause thinker, like I am sometimes, and you're doing the dishes, like Hannah said, and something comes up, we'll make sure that we send out a follow-up email that will also include Hannah and Diana's email address, all of the resources that were posted inside of the chat. And then, of course, if you would be so kind, the slides, so I can send those out as well. And then you'll have an opportunity to kind of dig in. And then if any questions come up, just an email away. So, all right, thumbs up if you want 5 minutes of your life back. See, no thumbs. Everybody's hanging. We're all hanging out.